What has not changed at SUHI in our 20 years is our mission. We have remained steadfast in our commitment to addressing health inequities, working with community to get the context we need, and then to really bring solutions to the community. Because in the end, that's what it's all about, and what we'll continue to be about is not research for research's sake, but really bringing those assets to the community in partnership with the community to build a healthier future. That has stayed consistent, and I think will always stay consistent.
And I think what I helped contribute over the last 4 years is much more of a solution focus, that we use and we bring together the best of academic public health research and evidence, and we look at ways to use those as solutions that can empower patients and individuals and communities so that they can live healthier lives, they can overcome barriers.
On a national level, SUHI has shown us a way forward, a way that integrates public health research, social epidemiology, data analysis, but also practical interventions through their innovative community health worker program. Right? It's integrated. It's not just describing problems, it's working with communities to achieve long-lasting and meaningful change.
SUHI has helped us really put a lens from the lens of equity on how to address our investing and addressing the needs of our region.
What I think I'll take from SUHI the most is that real drive and passion for working with underserved communities, especially in places like Chicago, where we have such amazing resources here. We have some world-class universities and health systems, but those resources aren't shared evenly. And I think that kind of experience during training has been really powerful.
A lot of people confuse sympathy with empathy. And one of the things that we do when we train community health educators is to really think about the difference and really understand the difference. Sympathy is feeling sorry for someone, but empathy is really understanding. And that's one of the things that SUHI does. You bring about information to someone, but then you take a step back and hear the community. Not be ready to jump in and provide any type of feedback, but really taking a step back and really relating to what the person is saying.
You know, your doctors can't come into your home, and they were really hands-on, coming into the environment, actually pointing things out and showing you, even down to your home care products, you know, what needs to be used to get rid of this and the mold and the toxins. And it was just a big, big help.
Es muy importante toda la ayuda que me han brindado, que ustedes se hayan preocupado por el trato que me hayan dado en el hospital.
Many safety nets have just a ton of needs from the hospital perspective, and it would be hard to find the resources to invest in a research and community-facing organization like Sinai Urban Health Institute. Safety nets don't necessarily have to start from the ground up. We're right here, ready to partner. And when you think about what SUHI does, quite frankly, partnering and collaboration is the hallmark of how we're effective.
We come to them with a problem sometimes, and they listen hard, and then they can repeat that problem back to us in a way that makes sense to us and help us to come to solutions. And so I think that their skills as listeners come really first in terms of collaboration, because it's not just landing on the ground with a research plan in hand and saying, this is the way it's going to be, guys. Instead, it's a collaborative process, working together to understand what the needs are, and then creating a plan that's going to work for everybody. And I think that that's second nature to them, and something that really sets them apart from some of the other research institutions in the city.